Hello everyone, I want to thank you for being here today. Today we're going to discuss infant CPR. According to the American Heart Association, approximately 1 out of 100,000 children die from heart failure each year, which according to LiveScience.com are the same odds you have of being killed by a venomous sting. I obtained my CPR certification at Naval Station Mayport Branch Clinic. If more parents and bystanders were aware of how to properly perform infant CPR, then it is possible that the number of infant deaths could be lowered. Today I will discuss basic terminology, responder head and hand positions, and the steps for performing infant CPR. I will clarify terms such as compression and breaths. I will show you proper hand placement and head movements, and how to properly perform CPR. When performing CPR, you will hear terms such as first responder, compressions, and breaths. A first responder is the term used to describe the first person to arrive at the scene, and as a first responder, you will coordinate the calling of 911, and you will also be performing CPR until emergency medical personnel arrive. The term compressions is used to describe the use of hands or fingers to press down on the chest, which is what stimulates the heart in the CPR. Breaths is used to refer to the emergency breathing process used to administer oxygen to the person in need of CPR. This must be performed in conjunction with CPR for the life-saving technique to be effective. Now that we have covered some basic terminology, let's explore hand and head placement. There are two types of head positions to be used: head lift, 10 chill, and the jaw thrust method. Head lift 10 chill is used when there is no concern of neck injury. If you did not see the child fall or infant, then you should assume that there is neck injury and not use the head lift 10 chill method. The appropriate method in that situation would be the jaw thrust. To perform the head lift 10 chill, you will place your palm on the victim's forehead, take 2 fingers and place it under the bony part of the chin, and tilt backwards to open the airway. For the jaw thrust method, you will cross your index finger over your thumb and place it into the mouth of the victim, and spread slightly to open the airway. Now that we have discussed head placement, let us discuss hand placement. For a normal-sized adult, you would use the entire hand on the chest. But due to the delicacy of an infant, it is important to be cautious of the amount of pressure that you apply. 2 fingers will be utilized for an infant. To perform compressions, place 2 fingers on the sternum, which is the bone that runs down the middle of the chest, and you want the fingers to be slightly below the nipple line. The goal is to accomplish 30 compressions at 100 compressions per minute. A responder will want to compress the chest 1/3 of the depth of the chest. We have now had a basic overview of terminology, head and hand placement, so let us all tie it together and perform infant CPR. The American Heart Association used to encourage ABC, which refers to airway, breathing, and circulation. They have since discovered that there is enough oxygen remaining in the body to perform 1 cycle of compressions. Therefore, it is now CAB, circulation, airways, and breathing. In order to ensure proper circulation, there must be 30 compressions at a rate of 100 compressions per minute. This ensures that sufficient oxygen is getting to the lungs and heart. Assuming that the infant has no neck injury, we will utilize the head lift 10 chill method. If there is someone close by, when you are the first responder, you want to send them to get help and call 911. If you are alone and you are close to a telephone, then you yourself should call 911. However, if you are not near a telephone, then you should continue with CPR. This is a decision that you will have to make as the first responder. First thing you want to do is place the infant on the floor or a table with a blanket underneath if possible. Check to see if there is a pulse or breathing, and you will do so by placing 2 fingers on the inside of the arm to check for a pulse, and then you will listen to see if there is breathing. If neither are present, place fingers in the middle of the chest and begin compressions at 30 compressions, 100 compressions per minute, compressing about 1/3 of the depth of the chest. You will follow this process by performing 2 breaths to ensure that there is proper oxygen. We have now covered basic terminology, head and hand placement, and steps to performing CPR. You should now have some insight into the actions and importance of CPR with infants. While it is not required to know CPR, it may save an infant's life. You would be praised as a hero and give the opportunity for a child to grow up and possibly save someone else's life. Do the responsible thing and become fluent in infant CPR. Thank you for your time, and please have a good evening.